I'm Dr. Bill Lowe. I'm the Deputy Registrar of the College of Physicians and Surgeons of Nova Scotia. The college governs the practice of medicine in the public interest. The three things we do mostly are investigate complaints against our members, register and license new physicians in Nova Scotia, and set standards for the practice of medicine. The college gets its authority from the government, and thus the people of Nova Scotia, through the Medical Act. Licensure of physicians is mandated by our Medical Act for the protection of the public. Licensing, certification, and regulation are not the same. The college regulates the practice of medicine in Nova Scotia, and medicine is considered to be a regulated profession in Canada. Licensing is the procedure by which the college approves your credentials and allows you to practice here in our province. Certification relates to recognition by the College of Family Physicians of Canada of your status as a family physician after passing their examination. First of all, family physicians in Nova Scotia provide long-term continuing care to their patients. The scope of their practice is often quite broad: adult and pediatric medicine, prenatal care, minor office psychiatry and counseling, minor surgical procedures. Many family physicians in Nova Scotia work in small emergency or outpatient departments. Some family physicians in Nova Scotia still deliver babies. Family physicians in Nova Scotia have a variety of practices. Some are rural, some are urban, some are group practices, some are solo. Most family physicians in Nova Scotia practice in small groups of 2 to 6 physicians. They practice primary care, therefore they are the first point of contact for an identified practice, usually between 1,000 and 2,000 patients. And they provide long-term continuing care to that practice. Family physicians practice primary care, therefore they are the first point of contact for an identified practice, somewhere between 1,000 and 2,000 patients. Many family physicians in Nova Scotia have a hospital component to their practice if they work in smaller, medium-sized communities. Family physicians are small business men and women, often employing a receptionist or a practice nurse. Some family physicians in Nova Scotia work in collaboration with a nurse practitioner. There are approximately 1,200 licensed family physicians in Nova Scotia. All family physicians in Nova Scotia are licensed by the College of Physicians and Surgeons of Nova Scotia. Between 2006 and 2008, the College of Physicians and Surgeons of Nova Scotia has licensed 156 internationally educated family physicians and specialists. The scope of practice of a specialist in Nova Scotia is much narrower than that of a family physician, but because of their training, they deal with problems in much more depth and at a higher level of complexity. Specialists in Nova Scotia see patients only on referral from a healthcare provider. The government pays for medical care on behalf of the patient in Nova Scotia for all insured services. That includes family practice care, specialist care, hospitalization, and surgery. In Nova Scotia, the patient pays only for non-insured services. For example, telephone calls by your physician, filling out forms, employment medicals, insurance medicals, and any cosmetic procedures. Family doctors and specialists practicing in Nova Scotia and in fact Canada have the same level of undergraduate medical school training. However, their postgraduate education differs. Family physicians enter after medical school a 2-year residency training program specifically for family practice. Specialists enter a 4 to 5 year residency program in their specialty. In Canada, Most medical students have already obtained an undergraduate degree at a university, taking 4 years. Then medical school is 3 to 4 years, and their family practice residency is 2 years, for a total of 9 to 10 years. If your training and practice was outside North America, you must successfully complete a clinical assessment process prior to being considered for licensure. The clinical assessment process we use here in Nova Scotia is CAP, Clinical Assessment for Practice Program.